Hypovascularity of the lung may be on a congenital or acquired basis. When we see lobar collapse, the hyperexpanded remaining lobe or lobes can reveal on radiograph hypovascularity. In this case, note the hyperlucency of the left upper hemithorax with blurring of the left heart border and a small left hilus. The lateral view of the chest shows typical signs of collapse of the left upper lobe. Note the hyperexpanded left lower lobe. The curvilinear density that crosses the heart is ventral to it, represents the collapsed left upper lobe. So the paucity of the pulmonary vasculature was due to the hyperinflation of the remaining left lower. This baby had a congenital diaphragmatic hernia that was repaired, and subsequently one can see that the left lung has become hypovascular. Note that the left hemithorax is hypovascular, and a density is seen in the left upper lobe. This baby had hyperexpansion of the lower lobe as a result of a hypoplastic lung, which developed as a consequence of the diaphragmatic hernia. In other words, the diaphragmatic hernia did not allow the proper development of the left lung. When the hernia was repaired, the lung was already hypoplastic, hyperexpanded, and there is a diminished pulmonary vascularity as a result of this combination of hyperexpanded, hypoplastic lung, and that is the reason that the markings were markedly diminished from frontal chest regular. Hyperinflation of the lungs may be the result of transient air trapping as seen with bronchial asthma. This patient had a middle lobe syndrome, that is collapse of the middle lobe, which results in blurring of the right heart border, and note that the lungs are markedly hyperlucent. In the lateral view of the chest, we see hyperexpanded lungs with some degree of flattening of the diaphragm. This is a reversible condition, and the increased pulmonary vascular resistance is a result of increased alveolar pressure. That's why we see a diminished pulmonary vascularity, but as soon as the acute asthmatic attack resolves, the lungs return to a normal vascular appearance.